welcome to the Melbourne Clinic, Australia's largest and longest serving private mental health facility. The Melbourne Clinic has 175 inpatient beds. It also has a very busy day program and outreach service for our patients who live in the community.
And we provide inpatient and outpatient care to patients suffering an array of psychiatric disorders.
The Melbourne Clinic has over 300 accredited psychiatrists and addiction medicine specialists. The professorial unit provides weekly, ongoing evidence-based education to all doctors and health professionals at the Melbourne Clinic.
The Melbourne Clinic is unique, firstly in its size, being 175 beds, and also the breadth of the programs that it offers.
The Melbourne Clinic offers a range of inpatient services. Patients are admitted for mood disorders such as anxiety and depression. The clinic also offers a range of specific programs for disorders.
The day programs are probably the most extensive within Melbourne and provide care and support to patients with a wide range of disabilities and psychiatric diagnoses.
Sometimes we've got up to 33 groups running in a week, and they focus on a number of different therapies, but the main aim is for people to be able to come along somewhere and access some skills and support and structure.
But the really great thing about the groups is that it gets people out of their isolation, and obviously when people have been unwell, the unwellness that they're experiencing often isolates them and stops them from relating to people. So it's a really important thing for people to get back into relating to others and socialising in a way that's really safe, so that, you know, once they sort of get on their feet with relating in this safe way, they can then move out into their lives and bring that into their relationships.
Melbourne Clinic Outreach Program is a community-based program where we go as clinicians and see people in the community suffering from a mental illness that have been referred to us by their psychiatrist. We're currently seeing 450 people across the greater metropolitan area of Melbourne. We also have the facilities to see people in Bendigo and also in Ballarat.
The clinic has a long association with the University of Melbourne, which involves both research around medication usage and also around teaching medical students and assisting with the training of psychiatrists.
The professorial unit is a 25-bed unit. We adopt a multidisciplinary approach, looking at both the biological, psychosocial, as well as cognitive approach for treatment. Our goal has been always to try to translate evidence-based into clinical best practice in the real world.
Amongst the clinic's specialist services, we provide an extensive treatment for people suffering drug and alcohol problems, and my own special interest is in old age psychiatry. We provide an extensive array of services for older patients.
The Melbourne Clinic has the largest eating disorder program in Australia. This comprises of inpatient treatment as well as day program and outreach. The clinic also is very proud to run an inpatient program for obsessive compulsive disorder. It is the only program of its kind in Australia, and referrals come from right across the country. The hospital also provides transcranial magnetic stimulation, known as TMS, for the treatment of depression. These patients have been assessed as having treatment-resistant depression and are referred to this program. The Melbourne Clinic is centrally located in Richmond, Victoria. There is on-site parking. It is well serviced by trains and trams to the front door. We also do have arrangements with local hotels for discounted rates for families of patients who are attending the Melbourne Clinic. If you are considering admission to the Melbourne Clinic, a tour of the facility can be arranged for you and your family.
I spend a lot of time with patients on encouraging them to really talk things through with their psychiatrist and give them the confidence to feel that they can inquire and stipulate what they want to achieve and where they want to get to and whatever. Because sometimes they don't feel very empowered to do that, just because of the mental status that they have at the time. But the big thing is to see that people begin to get a sense of hope. A lot of them just have felt that they're going nowhere, and gradually they begin to see that there is light at the end of the tunnel.
For more information about services at the Melbourne Clinic, please refer to our website or contact the emails below.